first rib, joint play, and mobilization. So we have the patient supine. Again, we're going to have, depending on the patient, we're going to have a slight towel roll under the occiput to prevent occipital extension. And I'm going to ask Jason to just cross his elbows for me. Just hold on to them there. What I'm going to do next is I'm going to lift his shoulder on the same side and put the wedge underneath. What that does is rotate the thoracic spine to the left, and then he's resting in that position. It also is going to let me get access to the first rib here. Eventually, when I have my hand in place, which I'll show you, I'm then going to turn the cervical spine to the right. So now we have thoracic left, cervical right. So that counter rotation helps to stiffen up the spinal segments themselves. They're using up all their movement. So that provides stability to the spine so that when I push on the rib, that the movement is happening where the rib meets the spine instead of just causing the whole spine to rotate with it. But I'm not going to turn his head yet because I need to find the first rib and get my hand in the right place. So again, here I'm going to go back. I can do this pressure on the sternum to figure out where T1 begins to move, and then I can move just lateral to T1. It's just lateral to the transverse process, so it's not very far lateral. Then the other thing is that trap muscle lays right on top of the rib, so we have to be careful and not just try to press right through the trap because that will hurt just about on everybody. So when we feel where that is, we're going to lift that trap out of the way and then pronate to neutral so that our hand is like this. Now underneath here, my hand kind of looks like that. Pulling it up. Now my elbow is down at the table because it needs to be lower. The direction of force that I need to press is like this. So once I get in here, I can then turn his head to the right and lift. It's more like I'm lifting from there. Is that okay, Jason? Yep. And then I would compare that to the play on the other side. For mobilization, it's going to be the same thing. I'm just going to hold it, and I can use his breathing a little bit to help too. So I'm going to lift and hold, or I can ask him to take a shallow breath in and blow the breath out, and then follow along, holding there. My left hand is kind of stabilizing his head with a grip around his neck for comfort, and so that if I'm not doing that, it's going to start moving around. So I'm just holding with a comfortable grip around his neck, stabilizing a little bit with the head. When a lot of times that first rib can be very stiff, and so we can pre-position, have my arm in that same position here. But an alternative during the mobilization is to hold on to the elbow so that I can do the mobilization and have some counter force here. I can put my elbow into my own side and lift and hold.